This is KTVO's Good Morning Heartland.
And welcome back. All week long, we've been looking at health screening and preventative measures you should take for your age group. This morning, we're taking a look at people in their 50s and above, and we have Dr. John Collins from Complete Family Medicine here this morning to break it down for us. How are you doing today?
Very good. Thank you for having me this morning.
Thank you for coming, and thanks for, I guess, concluding our health screening segment for this week. Earlier this week, we had your colleague, Dr. Gillette, and he was talking about screenings that people in their 20s and 30s should take, and what you are recommending is that people older than that, in their 50s and 60s and beyond, should continue that ongoing testing. And can you just touch base on what those testings are and why it's important?
Sure, that's exactly right. As my colleague had mentioned before, we talked about the idea that we should definitely make sure we're monitoring our blood pressure, checking our cholesterol, those kinds of things, as well as cancer screenings such as mammography and pap and pelvic exams. For those of you over 50, though, I'd also recommend that we add on to that skin exams because we've had more exposure to the damaging rays of the sun. As well, and I'd also consider dental exams because a lot of the disease processes that we have are either worsened or very difficult to manage or have infections and those types of things themselves that can come from that. So we definitely want to do that. And then finally, I'd also add eye exams. There are several disease processes that can be picked up early if we go ahead and have those eye exams. Those might be diabetes as well as hypertension.
Okay. And we were discussing a little bit about this yesterday when we met up, and you told me that it's really important that no matter how healthy you feel, somebody, nowadays in their 50s and 60s might appear healthier and in better shape than somebody in their 20s and 30s, but there's types of tests that they need to take in that age group, no matter how healthy they may appear. And what are those tests?
Yes, exactly right. And those tests would be two major ones. One would be a colonoscopy study, which is a direct visualization or looking at the inner lining of the colon using a specialized camera. And colon cancer is the number 4 cancer that we have in the United States, and we have a wide window of opportunity to treat that. And so at age 50, if we screen for that, we often will visualize the colon, and as well if there are polyps, which are the starts of those cancers, we can remove those and actually treat that cancer and cure that cancer at that time. Okay. So that's one of the biggest favors you can do yourself if you're in the over 50 crowd. Right. The other thing I would recommend is a cardiovascular evaluation, and that would probably include a stress test. However, as Dr. Wilson had mentioned yesterday, women are very different in the way that they express their heart disease, and so they need a special way of evaluating that. So with women, we often have you do a stress echocardiogram, which is a stress test that is done either on the treadmill or used with medicine to stress your heart. And then immediately after, they'll go ahead and do an ultrasound of the heart to ensure that it is not having any abnormalities in the way it beats or anything like that. That's probably maybe your second best gift to yourself at that age. So as we talked about, a lot of times you feel great at 50 or over, and you maybe even look great, but just as the car with higher mileage needs to be well maintained, that's the case as well. Often people in this age group are often have people that are dependent on them. That might be their children, or even in some cases their aging parents. So that kind of makes that health maintenance even more important.
And finally, what we want to talk about is vaccinations. When we think of vaccinations, a lot of people think, oh, those are just for kids. I got them when I was younger, but that's not the case. There's a lot of vaccinations that the elderly should consider, and what are those?
Yes, I think everybody hates shots, and I wish that was true, that it was only for kids. However, there are a lot of immunizations or shots, as we describe them, that adults need. One of them, pretty commonly, would be a tetanus, that we want to get every 10 years. But starting at age 50, we also want you to look at things such as the pneumonia shot, which there's a brand new one out called Prevnar 13, which is taking care of some of the more common pneumonia strains now. As well, we want to consider a flu shot every year. Again, we want to protect those people that are with us. Sometimes we're not protecting ourselves, but again, as we talked about, if we're caring for aging parents, we want to make sure that by us getting immunizations, we're protecting them as well.
All right. And do you have any other tips to give our viewers out there to help them maintain a healthy lifestyle no matter what age they are?
Yes, one last comment I'd make is that I think that everyone should have a primary care physician. And the reason I say that is that's going to be your tour guide to making sure that you're you're maneuvering the healthcare system properly, and that you're getting a specialized treatment plan just for you. It's kind of a cultural change because we're used to going to the doctor when we're ill, and we need to make sure that we're going to the doctor to seek maximum health.
Well, thank you so much. A lot of good information, and what we'll do is we'll post all of this on our website at heartlandconnection.com, as well as Dr. John Collins' information with Complete Family Medicine, and we'll be right back.